Hey, Dr. Gullberg here, continuing our infectious disease lecture series. Today we're talking about nosocomial infections or hospital-acquired infections. These are infections that are acquired after patients have been in the hospital for greater than 48 hours. So we see nosocomial infections in over 2 million hospitalizations a year. I mean, that's high numbers. Nosocomial infections add an average of 8 days to the hospital stay. Obviously, urinary tract infections add less than surgical wound infections or, nosocomial pneumonias or ventilator-associated pneumonias. Highest rates are in the teaching hospitals. Lowest rates are in the community hospitals. It's costing us about $3 billion a year in the United States. So most of the nosocomial infections are UTIs, 50%. Surgical wounds are about 20%. Pneumonia is about 18%, and primary bacteremia or line infections is about 5%. There is a whole group of what we call other, which is like the C. difficile diarrhea problem that we're facing now in the United States as well. The bacteria that we're seeing are gram-positive cocci, especially MSSA and MRSA. We're seeing Candida species. We're seeing gram-negative bacilli like Pseudomonas. We're seeing resistance increasing over the last couple of decades, seeing more MRSA. We're seeing more resistant gram-negative rods, such as extended spectrum beta-lactamases or ESBLs. We're seeing carbapenemase-resistant Klebsiella species as another example. So resistance to quinolones is increasing. We're seeing increasing resistance to enterococci, seeing VRE on the rise as well. Toyolopsis glabrata, a new pathogen that we're seeing over the last decade, and even Acinetobacter. Ratio of nosocomial infections ICU to non-ICU patients is about 4-to-1, and nursing understaffing is a reason why there could be an increased rate of nosocomial infections in your hospital. So this is just some introductory statements on nosocomial infections or healthcare-associated infections. Certainly be aware of their problem and how to summarize the different types. Basically, we're looking at urine, we're looking at surgical wound, we're looking at pneumonia, we're looking at primary bacteremias, and then we're looking at things like C. diff. Thanks, Dr. Gullberg, signing off.